The pair of irrigation and aspiration handpieces is an indispensable tool in modern cataract surgery. Traditionally, the irrigation handpiece is used only to maintain a steady inflow of BSS into the eye during the stages of cortex aspiration and viscoelastic removal, while the aspiration handpiece is moved more often to reach various corners of the anterior chamber and capsular bag. The present video demonstrates all the different tasks for which the irrigation handpiece can be put to use. Traditionally, the pair of irrigation and aspiration handpieces are used together to remove the viscoelastic. The process takes its own time, and some viscoelastic may occasionally be left behind here and there. Additionally, the iris or posterior capsule may get caught in the aspiration probe. When the irrigation handpiece is used alone or from the main incision, the larger incision imparts greater freedom of movement to the irrigation handpiece and provides a larger outflow track for the viscoelastic. It can remove the routine dispersive as well as the cohesive or a combination viscoelastic with greater ease in a more comprehensive manner and at faster rate. And surprisingly, this can be achieved with less than full pupillary dilatation. The irrigation handpiece can be safely taken behind the IOL to remove the trapped viscoelastic. And it can again be used to center the IOL perfectly. However, whenever the iris tends to prolapse from the main incision, using the pair of IA handpieces from the side ports is the best alternative. In that also, keeping the aspiration handpiece stationary in the center of the anterior chamber and moving the irrigation handpiece all around to remove the viscoelastic is more efficient to dislodge the viscoelastic from the angles of the anterior chamber, from behind the IOL, and from the undersurface of the endothelium. It is also safer as there is no risk of inadvertently catching the iris tissue or posterior capsule or an accidentally detached Descemet membrane in the aspiration probe. Secondly, at the end of the nucleotomy, if there is a small nuclear fragment or epinuclear sheet remaining, they can be delivered through the main incision using just the irrigation handpiece and depressing the main incision. Next up is hydroimplantation of foldable lenses. With the irrigation handpiece inserted from the side port, the foldable lenses can be implanted from the main incision. The constant irrigation acts like the AC maintainer and provides necessary chamber depth to facilitate IOL implantation. The dialer is used from the other side port to dial the IOL inside the bag. Hydroimplanting an IOL saves time to first insert and then wash out the viscoelastic from the eye. It also ensures its thorough removal, and it sure doesn't affect the clarity of corneas on the next day. For the hydrophilic IOLs, this process is simple after sufficient practice. However, the hydrophobic IOLs, being more temperature labile, do not unfold easily inside the anterior chamber under the constant supply of cold BSS. Hence, we have to stop the irrigation flow intermittently to allow the IOL to unfold slowly. We call this as dynamic hydroimplantation. Once nearly unfolded, the IOL can then be dialed into the bag. After a hydroimplantation, there is hardly any visco left to be washed out. The irrigation probe is then used to firmly tap the IOL to make it adhere closely to the posterior capsule. Here is another clip of the dynamic hydroimplantation. Sometimes the situation gets tricky and we have to use our instincts to save the day. Once the IOL gets back to its usual position, the rest of the process is simple. Similarly, for a little dialing of IOL to set it up in the right orientation, one need not put viscoelastic again in the anterior chamber. It can be done simply under a steady current of BSS coming from the other side port and a Sinskey hook from the other one. In the same manner, an additional side port can also be made or an existing one can be enlarged using the irrigation probe from the other side. Sometimes a thin sheet or web of cortical fibers remains on the posterior capsule, which requires capsular polishing to get rid of it. Though it can be done effectively in the cap-pack mode of IA, an alternative is to use the irrigation handpiece instead of the aspiration probe. The current of irrigation and a reasonably gentle rubbing by the tip of the handpiece removes the cortical fibers with no risk of causing a PC tear. This can be done for central as well as peripheral residual fibers on the PC. Loosening of the fibers by this maneuver then enables the aspiration probe to evacuate the fibers effectively. Cortex aspiration in a small pupil or in unusual circumstances like in this traumatic pediatric cataract sometimes becomes difficult due to iris getting caught in the aspiration probe. In such a scenario, the irrigation probe can be used to lift up the iris and allow the aspiration probe to engage the cortex and remove it. This can even be done in an adult cataract surgery under topical anesthesia supplemented with intracameral lignocaine. During anterior vitrectomy, irrigation handpiece can be used for continuous inflow of BSS. The irrigation ports are directed sideways, so it directs the BSS inflow above the iris plane. The amount of inflow can be adjusted by adjusting the height of the BSS bottle. In conclusion, the versatile irrigation handpiece can be subjected to multiple uses, which can come very handy during a cataract surgery and are very effective at the same time. There is a learning curve involved for some of the steps, while others are quite simple. I thank you all for your kind attention.